As Omicron surges throughout the United States, with the country seeing more than 7.6 million cases in the last 28 days as of January 5th, 2022, many Americans still lack access to testing and booster shots, despite the federal government's promise to increase the availability of both. Omicron made up 8% of U.S. COVID-19 cases in the week ending December 11th, 2021. Now, less than a month later, Omicron makes up 95% of cases. Yet people are waiting hours in line to get tested for free, or buying price gouge tests online that might take weeks to arrive. On December 22nd, President Joe Biden announced that his administration would be purchasing 500 million at-home testing kits to be delivered in January. On January 4th, during a COVID-19 press briefing, Biden provided no specifics on when in January these at-home tests would be distributed, but did advise Americans that insurance companies would soon be required to reimburse people who bought tests from private businesses. Where does that leave the uninsured, or people who simply can't afford to spare $25 on 2 semi-reliable tests? In line for hours, often in the cold, at whatever testing site they can find that is still accepting walk-ins. That means a worker making the federal minimum wage, which is $7.25 an hour, would have to work roughly 3.5 hours to afford one test kit, or take time off work and lose wages waiting hours in line. Either way, working Americans are losing money taking COVID-19 tests. Meanwhile, a number of Americans who can afford home testing kits are hoarding them to the point that retailers like CVS and Walgreens put purchasing limits on the tests. And some ultra-wealthy Americans are hiring concierge doctors to administer at-home tests to bypass long wait times. To top it off, the Federal Trade Commission warned Americans in early January to beware of fake testing kits, which have popped up online as consumers frantically search for quick alternatives to long lines. President Biden's refrain since Omicron appeared in the U.S. has been to
get vaccinated, get boosted. There's plenty of booster shots.
The CDC even tweeted an ominous graphic appearing to be aimed at scaring Americans into getting vaccinated for fear of exorbitant hospital bills. But as breakthrough cases rise and immunocompromised people face symptoms far more dangerous than the mild ones the CDC says are typical of Omicron, many are beginning to distrust the federal government. To add to Americans' confusion, the CDC reduced the suggested quarantine time for those who test positive from 10 days to 5 in late December. Though President Biden has reiterated his plan to make testing available to Americans in January through emergency testing sites and at-home kits, whether these solutions will be enough remains to be seen. And even if they are, waiting at testing sites is costly, and ordering a test online requires internet access, a privilege not all Americans can afford. So, to recap, COVID-19 cases are skyrocketing, getting tested is an economic privilege, and the federal government has yet to actualize its promises to help everyday Americans get the healthcare they so desperately need.